Welcome to the third installment of the COVID Conversation, hosted by the Catholic Commission for Social Justice and the Archdiocese Ministry for Migrants and Refugees. My name is Dominique Hefestun, and thank you for joining us today. In this time of the coronavirus pandemic, we're very keen to raise awareness about the need to get vaccinated. And I'd like to highlight a post that was shared on the CCSJ page this weekend from Catholic TT, which noted the fact that both Pope Francis and Pope Benedict have received their first dose of the vaccine. To quote the article, Pope Francis on the topic states, "I believe that ethically speaking, everyone should get the vaccine. It is an ethical option because your health, your life is at stake, but you also play with the lives of others." And we at the Catholic Commission for Social Justice, we're a Catholic organization, and one of the first tenets and the primary tenets of social justice is dignity of the human person and caring for those beyond us also because we are interconnected. With that being said, I would like to introduce our guest today, the wonderful and lovely Dr. Candis Gomez. Dr. Gomez is a board-certified pulmonologist. Dr. Gomez attained her medical degree at the University of the West Indies and did postgraduate training in internal medicine, pulmonary and critical care at the University of Miami, Florida, with an academic award with the Williams J. Harrington Program for Latin America and the Caribbean. Currently, she works at the NCRHA and in the private sector at St. Clair Medical. So, Dr. Gomez, thank you so much for joining us today. I know you're in the thick of things with this coronavirus. And so I'm gonna jump right into our line of questioning. Fortunately, our COVID numbers seem to be plateauing right now, which is a huge relief because arguably we were in a situation where we could have potentially seen health sector overwhelm, and in your capacity as a pulmonologist, were you witness to any situations such as that?
Right. So thank you very much for having me. And I'm very happy to do this interview because what information we can get out there to the public and the general community is very, very useful. So yes, the healthcare system has been under a bit of pressure for the last 6 weeks, I would say. The lockdown changes have occurred for about a month now. And what we were seeing, fortunate for us in Trinidad, we have developed a parallel healthcare system where there's one system that takes care of the COVID patient, and then there is another system that takes care of the general medical patients that come into hospital. The challenge, though, is that we have the same doctors and the same nurses. So you're taking the same doctors and nurses and you're shunting them between the two systems. I think the greatest challenge we have seen, though, is that, our third surge that we're experiencing right now is a result of the introduction of the Brazilian variant or the P1 variant in our community. And that variant generally makes people more sick. So in this wave, what we found is that people got sicker faster, and they came into hospital definitely having more symptoms. So yes, they came in very, very quickly and they had to be hospitalized immediately. Before we had a little opportunity, some people could stay at home, some people were able to stay in hospital, but this time around, a lot more people were coming into hospital sick and requiring that they had to stay in hospital. So that definitely meant an increased number of hospital beds that had to be allocated and more institutions opening up. And again, we're doing this to facilitate and allow people to be comfortable, to have oxygen, to have medication, to have the things that they need to have. And as a result of that, what has happened is some of our elective work. So a lot of patients complain they're not getting their hernia repairs, they're not getting their elective surgeries, they're getting what is called telemedicine clinics, where the doctors and the nurses are calling them on the phone, making sure they're okay and giving them a prescription. That service had to be pulled back a little bit to allow staff to be freer to go through and help out in the COVID hospitals. So yes, there has been an impact on healthcare, and definitely patients are not seeing their doctors as much as they would like and as frequently as they would like.
I'm actually glad you mentioned the Brazilian variant because it leads really nicely into our next question. The as you just said there, the Brazilian variant has a different impact on the body. So can you walk us through how, well, one, we could start with maybe the coronavirus in general. What, as in your capacity as a pulmonologist, how does it affect one's body? And then maybe speak a little bit to why the Brazilian variant is more aggressive. And it seems to me that when coronavirus came about, we were worried about our elderly population. Now it seems to be targeting younger people. It's almost as though the mutation has become more sophisticated. So could you speak a little bit to that?
So initially, the initial variant that everyone saw was the UK variant. That was the first variant. And then afterwards, the second. Now there are multiple variants happening. Okay, so the virus, once it stays within the community, it will divide, it will mutate, it will change. That's just the natural course of any virus or any bacteria. So they are generally smarter than we are. It's the same thing with bacteria and antibiotic resistance. You know, you have a antibiotic and it's sensitive to the bacteria. And then next couple of months or next couple of years, your doctor might say, well, you have a resistant bacteria, because these things continue to grow, they continue to develop, and they continue to change. So the current variant now, the South African variant, was the second known variant that sort of lingered on and continued to spread more than the others. And then now we're on to the third worrisome strain, which is the Brazilian strain. And then subsequent to the Brazilian strain, there's now the Indian variant. So we have to get accustomed to these variants, and then we have to learn what these variants do each time there's a new variant. So it's a constant learning process. It's a constant adaptive process in these viruses. So you can't say, okay, well, last month I did this, or last year I did this, I'm going to do the same thing this year. Every time there's a new variant, we have to change and we have to adapt. So yes, this variant definitely is affecting. So I think what happened before, the older persons that had a weaker immunity felt the symptoms of COVID more significantly with the UK variant. But this one, what is happening is that both elderly and younger people are feeling the effects of this virus. So people have to take that when they're looking at their lifestyle and their lifestyle choices. Mm-hmm. You know, okay, so last time around, you might say, well, okay, you know, it's the older people getting sick, so I don't have to worry. This time around, what we're seeing is the virus is attacking both populations equally, and of course, affecting people who have other medical conditions like diabetes, hypertension, asthma, even more so. And great. So what we have to look at now this time around with the Brazilian variant is that we have to be a little bit more strict with how we do our washing of our hands, the wearing of the mask, and watching your distance. But in addition to that, you also have to say to yourself that, you know, I need to protect myself by getting the vaccine. A year ago, we did not have the vaccine. We have the vaccine now. So what I tell my patients now in the office is that it's very prevalent, right? The COVID virus is here with us to stay. There's no more hiding out or hiding away from this virus. What the lockdown and the stay-at-home measures did was to give the medical community time to get the viruses and the vaccines in progress and to get treatments in progress. So you can't say anymore, well, okay, I'm going to stay at home, I'm not going to get the virus. You can't stay home forever. And the virus isn't going anywhere. It's here to stay. And we are going to get COVID. I think most of the world's population is going to get COVID. The question is, when you get COVID, is your body prepared to fight this infection? Have you given it the best possible chance that it doesn't cause any problems for you and your family?
You know, I'm glad you said that, because this is something that I wanted to address. Just like the flu, you know, the flu mutates every year, and we all get most of us get our flu vaccine, but it's not necessarily going to be the strain of the flu that is, of the virus that is circulating at the time. It's just a matter of preparing our body. But, you know, and I'm glad you spoke to the fact that we are also all eventually going to get the COVID virus. And, you know, I was reading one article, and not to scare our audience, but I do feel like articles such as this, where people express their experiences, is important in terms of making people more aware and more cautious. And I'd like to quote this article. This lady she'd gotten the vaccine, but I believe she'd taken the AstraZeneca and she'd gotten the first dose, but she hadn't gotten the second dose. And she contracted the COVID virus in the midst of her doses. And she says, COVID-19 is not just the flu. Having COVID is like being in an incredibly slow roller coaster. 1 minute you're up and the next you're plunged into an abyss of suffering. It sucks you dry, chews you up, and then spits what's left of you into a dumpster fire. And, you know, just to, again, not to scare anybody, but just to kind of raise awareness to the fact that this is something that we need to take seriously. Now, in your capacity as a doctor, as a pulmonologist, what kind of situations have you seen? How have people reacted to the virus? And, you know, is this something that we need to now bring across so people take it seriously?
Yeah, so the interesting thing with the COVID virus in general is that different people respond differently. So what the virus does, I mean, it's a virus. It's called coronavirus because it has spikes on the particle. The virus surface has spikes. And then these spikes attach to our cells, and the receptor is called an ACE receptor. So it attaches to our cells in our nose and in our mouth and in our eyes. And then the virus particle, the genetic material, goes into our cells and then uses the machinery of our cells to multiply and to make more virus particles. And then usually how our body responds is 3 ways: with inflammation, right? We can get increased mucus production. And in some people, they get sticky cells and they can form blood clots. So different people respond to the virus in different ways. So some people might just have a very mild symptomatic presentation where they may just have like a little bit of fever and flu-like illness. And that's because the body is basically trying to fight off the infection. So the mild symptoms are like fever, cough, some tiredness, and that's it. And then they have some people that have more serious symptoms and they will have difficulty breathing, or they may have chest pain. And that is because the virus, as it goes through our body responds by producing more and more mucus. And there's some people, if you have an underlying problem, let's say asthma, where there's already mucus in your lining of your lung, or there you have a previous lung problem, when that virus starts producing more mucus and more inflammation, you run into problems and you're not able to absorb oxygen as well as you should. And that's why a lot of people need oxygen when they have the COVID-19 virus. Some persons now, if you're diabetic, you may have a tendency towards infection. And then now you get a viral infection that weakens the immunity, and then other bacteria in your body or other bacteria you get exposed to, you get a super infection. So you may come in and you have a viral COVID infection, and then eventually you develop with a severe pneumonia. And it's the severe pneumonias that are actually causing the problems with increased death and increased hospital stay. Some persons have very sticky cells. So for instance, they get the virus, they have the mucus production, they're getting the flu-like symptoms, but then they get a blood clot. And one of the interesting things about this particular virus is a lot of people are reporting blood clots. And some people are presenting with strokes, which is a blood clot to the brain. Some persons are getting heart attacks, which is a blood clot to the heart. Other persons are getting darkening or blackening of their hands and their feet, right? Which is also another manifestation of blood clots to the extremities. And then of course, there's a blood clot to the lung, which is very, very devastating, because when you have a blood clot to your lung, there's no oxygen going to your lung, no oxygen going to your body, and a lot of people succumb to that as well. So the response of the person depends on their underlying comorbid illnesses. So if you're older, you're going to have a weaker immunity. Your chance of having diabetes, hypertension, or lung problem is there, heart problem is there. As you get younger, what you'll find is that some people who may be in their 30s may not have any comorbid illnesses, but they're obese. They have a very high, weight for their height. Okay, they have a lot of weight on board, and you say, okay, well, all right, the person was just a little big. But then when you start looking at having to breathe with a compromised lung, and then you have this heavy chest wall because you have so much weight on, or maybe because of your weight, you're not fit, you don't exercise, you don't swim. So you feel the effects of the shortness of breath more, and you're not able to withstand the low oxygen as somebody who is fitter and is more agile and is accustomed to exercise. So really and truly, it's difficult at this point in time for us to see who are the people who will do well. There's no test that we can do and say, okay, well, you will do well. You will not have problems with COVID, and there are other persons who may have a lot of problems with COVID. So I think from our data that we're looking at by the ministry updates, people who are diabetic, who have high blood pressure, who have heart disease, who have asthma, who have HIV, are the people who are running into problems with this virus in our setting. And even though we're a small country, we have a disease pattern of a developed nation. So we have the obesity like the UK and the US. We have the diabetes and the high blood pressure like many of these industrialized countries. So we're not a very healthy population. And then on top of that, we're now having to deal with the COVID-19 infection.
You know, you raised some points that I'd actually quite like to go into a little bit. You know, because one of the major concerns with getting the vaccine is this whole idea of the blood clots. But arguably, it's better to get the vaccine and prepare your body, because if you were to get COVID and, you know, and you're predisposed to sticky cells and blood clots, you're in a worse off position. So how could we really kind of address that? You know, is it better to take your chances and get the vaccine, you know, and maybe get a blood clot, or should you just hold out, get COVID and get a blood clot? I mean, it's the catch 2020.
Right. So that is the challenge. So the incidence of getting a blood clot from the vaccine is very, very rare. Oh. But I wouldn't tell people that that possibility does not exist, right? It's less than 1 in a million is the data that they put out. However, what we need to look at is the fact that if you do get a blood clot on the vaccine, you see the difference is when you have the vaccine, okay, then you're looking out for the blood, you know, you're looking out for any abnormal response to the vaccine. And there are medications that we can give you if you do develop a blood clot. So if you get your vaccine and after your vaccine, you find you're feeling unwell for no unknown reason, you're getting shortness of breath, you notice your hands and your feet are turning blue, at least we can give you the medication to counteract the blood clot from the vaccine, because we're looking out for it. As opposed to COVID, when you get COVID, we don't know how your body is going to respond or whether you will be the person that will get the blood clot or not. So the diagnostic likelihood of finding a blood clot is a little bit longer, a little bit more protracted. So what I tell patients is, yes, you can get a blood clot with, notably the data is out there about the Johnson & Johnson vaccine and the AstraZeneca vaccine. But they also have to remember that you can't get the blood clot from COVID. And not only can you get the blood clot from COVID, you can get the blood clot with COVID, you can get a pneumonia, you'll have problems with breathing and you have to be on a ventilator. So you're going into a spectrum where, yes, you can get a blood clot from the vaccine, as opposed to if I get COVID, I can get blood clot and other things.
Right.
The standard medical recommendation for persons who get the vaccine and they're having any form of abnormal side effects, they find that they're suddenly feeling short of breath, they're noticing any weakness of their face or their arms or their legs, or they're noticing that, you know, their tummy hurts for no specific reason, then go back to your doctor. Go to your doctor and say, I got the vaccine 3 weeks ago. I got the vaccine a week ago. This is what's happening to me. And the doctors have their tests that they can do to confirm whether you are having a blood clot or not.
You know, I think you've raised a critical point here. When you get the vaccine, it's almost as though you're in a controlled container and you can receive the necessary help immediately, as opposed to when you contract the coronavirus, then it really is a roller coaster. You don't know what's going to happen. You're not going to get the assistance that you need, and arguably in the timely response that you need. But you also raised a really good point here for our long-term development. We, as you rightly said, chronic non-communicable disease is the #1 killer within Trinidad and Tobago. We have issues with heart disease, with stroke, with diabetes, and with, obviously, you would know, with the whole Sahara dust issue, we have issues with increased situations of asthma and respiratory sort of illness. But, you know, there seems to be a need for people now to take responsibility for their personal well-being, because the health system can only do so much. And things such as the coronavirus pandemic have highlighted our needs to be healthier as a population. Because as you rightly said, even though we are a developing world or developing country, we have developed world issues, especially with our diets. The KFC, I know everybody in the lockdown was really upset with the fact that they can't get their KFC, but surely that might not be a bad thing, especially in this time. We have to be healthier. So again, I'll push, and thank you for this really rich conversation that we've had, is about getting the vaccine. So how best can people now go out, get registered, and get the vaccine? And what groups are immediately being served within TNT?
Sure. So right now we have available to us two forms of the vaccine. There's the AstraZeneca vaccine, where some of us may have gotten the first dose and we're now due for the second. And then that is the vector, what they call the vector mediated vaccine. And then we have the Sinopharm, which is the inactivated vaccine. And what I would like to stress with the Sinopharm, I know there's a lot of concerns about the Sinopharm. But the challenge with the advantage of the Sinopharm is that it follows the same manufacturing process as the annual flu shot. So they take the virus, they attenuate it or they kill it, they break it up into smaller portions, and they take certain components of that material to make the vaccine. So it's very, very similar to the flu shot. It's grown usually it's grown in an egg medium. Right? So persons who are accustomed to taking the annual flu shot should not have a problem with taking their Sinopharm vaccine, because it's old technology. Now, there's a lot of questions about vaccine efficacy. So you hear people saying, oh, we getting the bad vaccines in Trinidad. You know, the US getting the Pfizer and the Moderna, and we getting Sinopharm, and Pfizer and Moderna is 95% effective, and our vaccine is 55% vaccine. So a lot of causing to the hesitancy. But what we have to remember is that when the Pfizer and the Moderna was developed, we didn't have these new strains. Later on, as newer vaccines came on stream, the response to the vaccine and the strain changes. So it's quite possible, we don't know yet, we don't know if the Pfizer and the Moderna vaccine will be as efficacious to the current strains. Nobody knows this. This is a process in evolution. So the thinking is, take the vaccine that you can get. It's no sense saying, okay, I'm going to wait until I can get a Pfizer vaccine, or I can wait till I get a Moderna, because as many people we get vaccinated as possible, the better it is for us to reduce the virus from replicating and producing more and more variants. So I think as of tomorrow, people can just walk in to the designated vaccine centers for your region. And once you're over 60, you'll be accommodated for the vaccine. Once you're under 16, but you have a medical condition, just call your general practitioner, go to your health center, just get a quick letter saying, I attend this health center, I have asthma, or I have hypertension, or I have heart disease. And then you go to the vaccine center to get the vaccine. Now, what we don't want now is the flip side, where everybody decides to go tomorrow to get the vaccine. I mean, you have to be sensible about it. If you go early and you see a lot of crowd, well, then there's no need for you to get the vaccine that day. Just come back the next day or come back next week. I think what has happened now is that we have enough doses coming in to spread the vaccine process out. So people don't even need to do the appointment system anymore. They don't have to do the WhatsApp thing anymore. You just basically go to the vaccine center, you fill out their consent form, you have your medical letter from your doctor if you're under 60 and you would like to get the vaccine, and you can continue and go on with that process. What we haven't done as yet, and it's reasonable, is that we haven't gotten clearance for the children to be vaccinated. And that's because the vaccines that right now are being studied, all the vaccines are being studied in children. Once that data comes out, then we will be able to say, yes, we can vaccinate children or anyone under 18. So for now, if we could vaccinate most of our adults, I think that would be a very good position for us to be in. And then the next step, of course, will be looking at vaccinating children.
Well, that was actually really informative because you gave some very current and up to the minute information there. And I'm glad once again that you highlighted the kids because we would all like schools to reopen. We've been closed for over a year now, and we want to get back to our regular lives, you know, post this new normal, that situation that we've all had to become accustomed to. So, you know, again, to reemphasize your point, there's now no need to register via WhatsApp. You can just go to your local health center where they're distributing vaccines and fill out the form and hopefully get your vaccine. So, Dr. Gomez, the time has flown. Thank you so much. This was, as I said, an extremely rich conversation and very important in raising awareness right now. As the Pope has said, get vaccinated. There's really no ifs, ands, or buts about it at this stage. If we want to continue life and get back to our normal daily life, we now need to get vaccinated. So on behalf of the CCSJ/AMMR, I would like to say thank you for taking the time to join us today. Once again, raising very critical awareness, especially in this time. And thank you so much.
I just wanted to add one thing.
Sure.
My husband is a comedian. So he said, you know, they have the thing, wear your mask, wash your hands, watch your distance. His thing now, he's saying is that when you're getting your vaccine, where you're getting your vaccine, and why you're not getting your vaccine. So he told me that, you know, we need to change the thinking from isolating and hiding out to now moving forward, getting vaccinated and getting on with it. Well, so I just wanted to put those new 3 W's.
Nice. No, you closed it perfectly. So thank you so much. And best regards to your husband. He's good. He's good.
Okay, take care. Thanks so much.